same old story.
Hi, my name is Justin Tucker. I'm an obstetrician and fertility specialist and the proud founder of referral, a private practice based in and around Sydney. I'm also a fertility specialist affiliated with Monash IVF. There are many people out there who have either booked or are considering booking to see a fertility specialist and are probably wondering what that appointment will entail, what might be expected of them, and how the whole thing will end up. So I'm here to demystify some of those things for you today. In terms of preparation, I think thinking about a GP referral would be a good idea. We always want to make treatment as affordable as possible. And with a GP referral, you can get a Medicare rebate as long as you do have Medicare cover, and that'll save you around $80 back from the initial consult. Now, every fertility specialist will have different pricing and it should be available on their website, and you certainly should find that out as part of the booking process. Not all patients will have had investigations done prior to their first appointment with a fertility specialist, and that's totally fine. However, if you do have them, the fertility specialist will be interested in seeing the results, so it'd be fantastic if you could bring them along. I think it's important to understand that there's really no expectations of you in your first appointment other than hopefully to be engaged. And certainly what I would hope is that we also provide an environment where you feel welcome and comfortable to share your story. And I think story is an important word. Learning where you've come from in order to be able to work with you is really an important role for the fertility specialist in that first visit. In general, things like past medical history will be relevant, any medications you might have, and then basic things like allergies, previous operations, and then usually in a fertility context, things like your period, the length of it, the frequency, volume, pain will be explored, any pregnancies. If you've got a partner, then bringing them along is not necessary, but usually quite useful. That first appointment is really to get an idea of the context, history, and if your fertility involves somebody else, then getting both sides is really important. If you don't have a partner, then bringing a support person is also totally fine for similar reasons, but it's also completely reasonable to come on your own. Overall, your fertility specialist is here to learn about you and help you learn about your fertility. Together, you'll workshop some goals and then a plan that's thorough, methodical, efficient, cost-effective to achieve that goal. Your fertility specialist has a lot of knowledge to share. They'll be your advocate. They'll be your ally. So go out, find one to work with, and make 2025 your year.
Of a boy and a girl in love.